Hi, everyone. I'd like to talk to you today about mindfulness-based cognitive therapy, kind of what that is and how it works. So mindfulness-based cognitive therapy, also called MBCT, is a form of behavioral therapy that incorporates principles of mindfulness. Now, mindfulness is a state of being where you're fully present in the moment and not reacting or judging your thoughts and emotions. Thoughts and emotions are constantly coming and going, so we simply observe them rather than react to them. The mindfulness practice that is emphasized in MBCT is called insight meditation or mindfulness meditation. And it's thought to help the practitioners to understand the concept that thoughts and emotions come and go all day long, and you are not your thoughts. The other main component of MBCT are cognitive behavioral therapy techniques. Cognitive behavioral therapy, CBT, is a widely utilized form of psychotherapy, typically used to treat anxiety disorders and depression. It focuses on the relationship between one's thoughts, feelings, and behaviors, with the goal of changing the behaviors. The guiding principle of CBT is that our thoughts influence our feelings, and that our feelings influence our behaviors. So to change our behavior, we must first change our thoughts. The behavioral element of CBT also makes it an effective treatment for conditions such as eating disorders and substance abuse disorders. The combined principles of mindfulness and CBT can effectively teach people how to prevent negative thoughts or emotions from triggering a deeper negative state or any harmful behaviors. The mindfulness principles and practices, such as meditation, taught during MBCT sessions, help clients change their relationship with their potential triggers. Then they can experience negative thoughts without letting them overly influence their emotions and behaviors. It helps to alter one's thought processes so that they do not immediately have a negative emotional response to potentially triggering situations. Rather, they understand that there are alternative ways to respond to these situations and process their emotions. For example, insight meditation and deep breathing are effective tools that one can implement in stressful situations or when unpleasant thoughts do occur. Learning these alternative strategies to handle thoughts can prevent potentially triggering thoughts from evolving into a deep depressive state or a deep anxiety state. The combination of traditional CBT with mindfulness practices help people break free from their negative thought patterns and learn strategies to manage their depression or anxiety. The concept of combining mindfulness practices with traditional therapy to form MBCT was inspired by a practice known as Mindfulness Based Stress Reduction, MBSR, and this was introduced by Jon Kabat-Zinn in 1979 and has helped countless people since. Kabat-Zinn developed the program after studying under Buddhist teachers who taught him about Eastern philosophies, including mindfulness. He combined these teachings with his knowledge of Western medicine and psychology to develop MBSR. So, what are the benefits of this mindfulness-based cognitive therapy? One benefit is more of a sense of control over your thoughts, which sounds counterintuitive because the suggestion is actually not to try to control your thoughts. We'll explain how that works. So MBCT makes an impact on individuals' lives each day by teaching them how to understand their thought processes and patterns better. This makes it easier to recognize the thoughts and signs that might lead someone down a negative path and prevent it from happening. MBCT promotes living more mindfully in general, not just during therapy sessions or while practicing meditation. This can help people get out of their heads and connect with the world around them, which can make it less likely for them to spiral down into a dark place when negative thoughts do come up. MBCT practitioners are more likely to be able to manage their negative or depressive thoughts or their anxious thoughts and ultimately let go rather than letting the thoughts evolve into a deeper state. Along with meditation, another one of the mindfulness practices emphasizes in MBCT is deep breathing. Deep breathing can calm the nervous system in stressful situations, which will help practitioners resist the natural urge to react in those situations instantly. Mindfulness can also reduce stress because it helps practitioners become more aware of the present moment and the world around them, which really can spark a greater appreciation for life and lead them to reevaluate their priorities. Additionally, when living in the present moment, one is not thinking about past mistakes or future obligations. Both of these factors combined can make MBCT and general mindfulness practitioners feel less stressed in everyday life and respond better to stressful situations. So, what are some of the effective tools to combat stress, and how does that work? What are the outcomes? One is improved mood. Both mindfulness practice and cognitive behavioral therapy have been shown to improve mood and help people who have depression. Even those who do not have depression can benefit from MBCT by learning how to stop less intense feelings of sadness or an unfortunate incident from turning into a deeper state of unhappiness. When practiced regularly, mindfulness can help some people feel more connected to their purpose in life, thus staving off feelings of worthlessness or feeling lost. This may be because mindfulness allows people to be more tuned into their surroundings and more appreciative of their everyday routine and life. When paying attention to what is happening, rather than allowing ourselves to be distracted, either by thoughts or externally, we not only appreciate things more, but notice our impact on the world more than we otherwise would. Mindfulness has also been shown to develop parts of the brain that decrease anxiety and increase feelings of positivity. So that's an important concept. It's called neuroplasticity, the ability of the brain to really rewire itself through practices like insight meditation and other cognitive behavioral techniques. So who should try MBCT? Mindfulness Based Cognitive Therapy is most commonly used for the treatment of depression and anxiety. Those who have episodes are more likely to experience significant benefit from MBCT. This is likely because MBCT helps those who live with depression and anxiety to learn how to manage their feelings at the first sign and symptoms. This helps them know how to get out of their thoughts and prevent the feelings from turning into much more painful experiences. Additionally, implementing practices like meditation can help prevent feelings of depression and anxiety from getting deeper. It can serve as a strategy for those who live with those experiences feel a bit better when their anxiety and depression does hit. It's important to note that MBCT is not the only effective treatment for depression and anxiety. Many people do benefit from medications and more traditional forms of therapy, but please consult with your doctor or your primary care physician before considering any medication options. Even those who do not live with depression can benefit from general mindfulness practices. In today's world, many people experience some levels of stress, anxiety, and depression. Mindfulness practices can help everyone feel more positive, relaxed, and in tune with their surroundings and the people in their life. So, insight meditation. This is one of the components taught in MBCT, but anyone can practice insight meditation. Meditation can help facilitate greater awareness and non-judgment in everyday life. And this meditation does not have to be hours long and that you have to sit in a certain position and et cetera, et cetera. And it's definitely not trying to get your mind clear of thoughts. Insight meditation helps you focus actually on your experience as it arises. So in the meditation sittings, we pay attention to sounds in our environment. We pay attention to our breath. We pay attention to thoughts as they come and go, emotions as they come and go, and also physical sensations in the body as they come and go. So over time, what this teaches us is that all of these experiences come and go, that they are not who we are, they're simply experiences within us that we can observe. And that detachment, that moving away from those experiences, particularly the painful ones, helps us really to let go and live more in the present moment. So I facilitate a live Zoom insight meditation setting on Sunday mornings from 11 to 11:50 Eastern Standard Time. It's free and open to the public, and you don't have to have any prior experience to join us. And you can, of course, you don't have to sit through the entire 50 minutes. You can leave anytime you like. So feel free to join us. I will post the Zoom meeting information on my website and in my emails. If you need to reach me, please contact me at Insight, I-N-S-I-T-E, Integrative, it's all one word, Insight, I-N-S-I-T-E, I-N-T-E-G-R-A-T-I-V-E, Insight Integrative, at gmail.com. I hope this information was helpful, and if you would like to begin this MBCT process, you're welcome to contact me, and if I have some therapy openings, we can certainly talk more about that. All right, have a good day, and we will talk to you soon. Bye-bye.